No, so wouldn't make any recommendations to a family based on the fact that the child uses delayed echolalia. Um, like, because I would be looking at, their whole communication profile to know what to recommend. But one thing to keep in mind if you have a child who uses delayed echolalia is to be extra careful. We want all parents to do this, but be extra careful that you're modeling from the child's perspective. So if they're at the single word level, you'd be modeling single words. If you are modeling full sentences, you'd want to be modeling from their perspective because you know that they're likely to echo you. So instead of, do you want juice? Probably I'd be saying just juice. But if you're trying to produce a longer sentence, I would say, I want juice or we don't love teaching I want early on, so we might be teaching more like having them model talking about where to put the juice in the cup or juice in the bowl. Um, and then that can be something that they work on with the child, so they can be working on using those teaching two-word utterances using behavioral strategies, like deliberately teaching it, just the way we would also though with someone who doesn't, have delayed echolalia. As when it comes to apps, no. Um, if a child produces delayed echolalia but does not produce immediate echo, so does not imitate. So if you say they want juice and you say juice, but they will not imitate juice, the first step is to try to teach them to do that. But if you have a clinician working with your child, and I'd recommend it be an SLP BCBA, um, or an SLP or a BCBA, but who's working, if they're working collaboratively, that could be helpful. Um, so you'd want to first try to teach your child to imitate, because if your child is mostly producing scripts, not putting together their own novel utterances yet, and does not have their own single words and will not imitate your single words, the way to teach them is going to be by having them imitate you. But if they're not yet imitating you, you need to teach them to imitate you. Um, and so if you're at the stage where you're just teaching that imitation and they're not yet doing the imitation consistently, you need another way for them to communicate. And that's where augmentative communication would come in. And so there's apps to use for that. There's a bunch of them, so I wouldn't recommend any one specific one. And the SLP making that recommendation, or the BCBA makes that recommendation by doing an assessment and trialing different systems. Um, so yeah, I can't say I would recommend a particular app, but like using augmentative communication for someone who does not imitate spoken language readily, that could be helpful. I wish there were apps, but no, it's hard work by the parent or clinician working interactively with the child.
Okay,
I
awesome.
guess, sorry, I could add one. One would be, sorry, yeah, well, the VB map is available as an app. It's an assessment tool and it can guide parents as to what to be teaching. It is quite complex, so it's hard to do without a clinician who's like experienced in it, but it exists as an app.